Positive behavior support, or PBS, is an approach rooted in compassion and dignity, aimed at enhancing quality of life while addressing challenging behaviors. PBS acknowledges that behavior serves a purpose and communicates an unmet need. Direct care professionals who embrace PBS principles recognize that challenging behaviors aren't just obstacles to manage, but opportunities to better understand and support individuals with developmental disabilities. A foundational principle of PBS is the emphasis on understanding the reasons behind behaviors. Every behavior, especially challenging ones, communicates something vital about a person's internal state, needs, or preferences. By identifying and addressing these underlying factors, care providers can proactively reduce situations that lead to problematic behaviors, creating a more harmonious and supportive environment for everyone involved. Central to PBS is person-centered planning, which emphasizes the individual's strengths, interests, and preferences in shaping care and interventions. Direct care staff collaborate closely with the individual, their family, and other stakeholders to create personalized support plans that respect the person's autonomy and promote their active participation in life decisions. This process not only mitigates challenging behaviors, but also fosters self-determination and empowerment. PBS also strongly advocates for environmental modification. This involves thoughtfully adjusting the individual's environment to minimize stressors and barriers that may trigger negative behaviors. Modifications might include reducing excessive noise, structuring routines to provide predictability, or ensuring that the individual has access to familiar and comforting objects or spaces. Such adjustments can significantly decrease stress, anxiety, and subsequent challenging behaviors. Another core principle of positive behavior support is teaching and reinforcing positive alternative behaviors. Rather than merely attempting to suppress undesirable behaviors, direct care staff actively teach and encourage appropriate behaviors that serve the same function. For example, if an individual engages in aggressive behaviors to gain attention, they might be taught alternative, positive methods for seeking interaction, such as verbal requests or signaling gestures. Consistency in implementing PBS strategies across various environments and team members is vital. All direct care staff, family members, and community supports must apply the principles uniformly to reinforce learning effectively. Consistency provides clarity, security, and predictability, significantly enhancing the effectiveness of interventions and fostering a stable environment where the individual can thrive. Regular monitoring and data-driven decision-making are integral to developing a positive behavior support plan. Direct care staff, through daily documentation, collect information about behaviors and interventions to help case managers and the individual's team assess their effectiveness. Data collection allows for objective evaluation, helping the team to fine-tune strategies and promptly respond to changing needs or situations. This continuous cycle of assessment and adjustment ensures that the positive behavior support plan remains relevant and effective. The positive behavior support approach also prioritizes proactive rather than reactive strategies. Instead of responding only after a challenging behavior occurs, PBS equips care providers to anticipate potential issues and intervene before escalation. By understanding triggers and early warning signs, staff can utilize preventive measures and de-escalation techniques, significantly reducing the frequency and intensity of challenging behaviors. Cultural competence and sensitivity are also emphasized within PBS. Recognizing and respecting cultural backgrounds, values, and communication styles helps to foster trust and understanding between direct care staff and individuals receiving support. When care providers acknowledge and integrate cultural considerations into their practices, individuals feel more respected, understood, and motivated to engage positively. Consider a scenario involving Alex, who has a detailed, positive behavior support plan designed to minimize aggressive behaviors triggered by sudden changes in his routine. The plan specifies clear communication about daily activities and any unexpected changes. However, if a caregiver neglects to communicate a sudden schedule change clearly to Alex, this oversight can lead to increased anxiety, confusion, and ultimately an escalation into aggressive behaviors. Such an outcome affects not only Alex, but also places stress on staff and peers, illustrating how critical adherence to the positive behavior support plan is for everyone's well-being. Finally, the positive behavior support approach underscores collaboration and teamwork. Effective support for individuals with developmental disabilities is achieved when direct care staff, families, educators, therapists, and medical professionals work cohesively toward shared goals. Open communication, mutual respect, and collective problem-solving foster an inclusive community where individuals receiving care experience improved life satisfaction and meaningful inclusion in everyday activities.